Hello everyone, welcome to InnoHEALTH Conference 2024. I am Mercilina, your host for today's InnoHEALTH magazine podcast. Today we have Captain Dr. Indira Rani with us. Very warm welcome, ma'am. Can we have a brief introduction of yours?
Thank you. And I'm Indira Rani, Captain and doctorate in health economics. I've done my education from Armed Forces Medical College, where I was a faculty too. Later on, then post-graduation, then MPhil, then doctorate from IHMR in health economics. I have around 35 years of experience, then both in clinical as well as academic. Right now I'm as a Chief Nursing Officer in Max Healthcare, previously it is JP Hospital, heading the latest technology and making my nurses to work with the patient and get a better clinical outcomes. This is my profile.
It was great hearing from you that. And as you just mentioned that you work closely with nurses. So what are the potential challenges that you think that nurses face when it comes to the AI integration into the healthcare?
Absolutely, good. It's a very good question. In fact, like many people talk of AI, what exactly we are on the platform and we are really facing this. When the nurses come from the academics, from novice nurses as from the colleges, they are tech savvy. It is not that they are not, they are, but with their Android phones and laptop softwares, not with the healthcare technology definitely, because their education is mostly on a private nursing colleges or a government colleges where they are not much equipped. Like now the private colleges and government also is taking, like in terms of simulation labs where you have a simulators where you learn all the clinical procedures, or in terms of smart boards. Smart boards also are there in few colleges. So the academic side, they're getting equipped. It takes some more years for us to have a tech-savvy academics completely, because nursing is one profession where you cannot be totally technology driven. You have to be human touch driven. That is our essence of nursing. So when the nurses come to me as how I adapt to them with the technology, at the same time keeping the core element of nursing, caring is our core element, keeping the core element and adapting the technology is always a challenge to me, and we put them in upskilling of their various the gadgets. We use it in the clinical side and they undergo thorough training of around 40 days is the minimum. Then in stepwise we upgrade and upskill them to adapt the technology and do the patient cares.
So ma'am, as we all know that we have a curriculum in nursing. So what are your thoughts on the curriculum, that it needs to get remodulated, reframed in order to keep the pace with the AI?
Yes. This is, you see, this is one of my favorite question and favorite answer which I would like to answer, because the nurse leaders are the people who are in the academic programs who are doing the curriculum development. Recently, INC, Indian Nursing Council, has developed a curriculum with a semester system where they try to integrate a lot of technology, but still somewhere we are lacking. Like you see, the quality standards and the artificial intelligence, which is not much given importance in the curriculum. I think recently, which is in 2000, I think. Not much of importance is given for the artificial intelligence, because that time when we developed the curriculum, that was not there that much in a boom. Now it is, like we have a robotic there.
Yes.
We have so many things. 100% that artificial intelligence is just entering our hospital gates, but we have in the form of other like apps, we have digital platforms. As such, AI has entered in the like in OTs, operation theaters, in terms of robotic surgeries, where our nurses are upskilled to assist the surgeon along with the AI. And truly speaking, the clinical practice we have not yet got it. Like truly, the AI has not entered, but we are equipping our nurses with the like we get a lot of AI generation companies who come and they tell us, and we know that there's something coming and we have to do it. So we are fully prepared. I think the young generation of nurses are fully prepared, Gen Z, to work with AIs.
Very happy to hear that, ma'am. Just one more thing would like to ask. As we all know that nurses are hard workers. They are the frontline workers, and they have a lot of pressure and stress. So, is the AI is helping them in doing the things and helping them out, making the things easy, or is it creating the other way around?
Okay, it is how AI has not entered in the Indian hospital healthcare system completely in the bedside. We have not yet got it, but we will be under 2 years, 3 years. You see the complete merging of AI with the nursing, especially with our profession. This is how you handle the artificial intelligence. They are not going to tell us what we are going to do. So you should understand how you handle artificial intelligence, how you give prompts to that AI or robot to do the tasks. Like some of the many tasks which nurse may not be able to do it always in her shift times is that attending a small thing, attending a call bell. Okay, so when a patient presses a call bell, all patients are attending, they want the nurse to be there because they know that they have a confidence on the young nurse that she will be able to help me or she will be able to say. But it's not always possible for the nurse to attend a call bell. So some of the things like call bell attending or some drip getting off or drip is completing. So some of the so many non-nursing duties, the AIs can do it. They can see everybody is doing the infection control practices or not, doing your documentation. Suppose something you have done it, you're monitoring of vital signs, which the nurse is exhausted or stressed and she enters some instead of foreign see, and immediately they correct and give the prompt. So we can it definitely with the changing healthcare technology, nurse cannot say that I will not work with an AI. They will be, as I said, Gen Z is ready to embrace AI along with the patient. So this is a boon in terms like the hospital administration use it very carefully, and where it is the AI is required, AI need to be there. Where AI is not required, it is not to be there. Some of the there is a confusion like technology and the artificial intelligence. Technology, we have already intensive monitoring, hemodynamic monitoring in the critical care units, where you get all prompts like your vitals are coming down, your BP is low. We get all alarms ringing. That is a technology. The artificial intelligence is like which is very important for the lab analysis in the labs, when you get a report, or in your invasive investigation like your MRIs, your CT scans, or your other invasive like cardiology or any other related, where AI immediately tells you what you are supposed to do it and what's the abnormality. If you find like yesterday or today morning in the news, the artificial intelligence took few seconds to tell the surgeon there is a part of the tumor is still left in the cranium. You know that, I'm sure you might have read it. It is just latest thing. So that fast, within few seconds the surgeon knows that a small chip is left or small thing is left. So it is how we handle the AI. They cannot distract us, they cannot take our human touch or human caring, but they can definitely assist us in better patient outcomes and better patient satisfaction.
Thank you so much for having such an insightful discussion, Captain Dr. Indira Rani, and I hope all our listeners might have gained a lot of knowledge from your expertise. So thank you so much for joining in today's podcast session.
Thank you. Thank you.